Hi, this is Dr. Virendra Patil. I'm pediatric hematology, oncology, and bone marrow transplant physician working in Basavatarakam Indo-American Cancer Hospital and Research Institute, Hyderabad. So, the reason for doing this Childhood Cancer Awareness Month is to increase the awareness in the public regarding childhood cancer. So, childhood cancer as such is a rare disease as compared to cancers in adults. We see about 3 to 4 lakhs children newly diagnosed every year across the globe. And when it comes to India, we can say that about 50,000 to 70,000 new cancer are diagnosed in children every year. So looking at the population, the load of cancer is definitely huge. So it is very important for the public to be aware about the cancers, because many people do think that cancers do not happen in children, and many people do not know that even cancers happen in children. So as such, children are prone for developing cancers, but we do not know exactly the reason why these children develop cancers. When we say that there are no reason well known to cause these cancers in children, we mean that there are multifactorial reasons. There can be many reasons which act together, unfortunately, makes the child develop any particular cancer. So the cancers in children are way different as we see in cancers in adults. The adults' cancers are most of the times influenced by lifestyle, like smoking causes lung cancer, consumption of alcohol can predispose to different cancers. But those kind of cancers are not usually seen in children. So we see different kind of cancers as compared to adults. Comparatively, we can say that the cancers in children are very aggressive in nature. They usually present advanced stages, and they usually start within some months and then they grow very fast. So it is very important for the public and also the treating pediatricians to be aware of these kind of presentations, because it is very important to catch the disease in very early stage so that we can provide best results to them when provided treatment in an adequate manner. So the types of cancers which are seen in children it can be divided into liquid cancers and solid cancers for understanding purpose. In liquid cancers, we have leukemias and lymphomas. Leukemias and lymphomas also called as blood cancers. In leukemias, we have ALL, AML, CMLs. In lymphomas, we have T lymphoblastic lymphomas, Burkitt's lymphoma, DLBCLs. So these are some of the lymphomas and leukemias which are seen. In solid tumors, we can see different types of tumors according to the site of origin. There are brain tumors. Brain tumors, most commonly we see medulloblastomas, glioblastomas. And when it comes to abdomen, we see there are two important organs which can predispose to cancers in abdomen. They are neuroblastoma and Wilms tumor, which usually happens in very early age of the children. There are bone cancers like osteosarcomas and Ewing sarcomas. There are soft tissue sarcomas like rhabdomyosarcoma and non-rhabdomatous soft tissue sarcomas. So even retinoblastoma. So retinoblastoma which happens in eye, and some rare cancers like synovial sarcomas, soft tissue sarcomas, so which are not usually seen. So the important is, how do we treat this childhood cancer? Treatment of childhood cancer involves three important modalities of treatments. One is chemotherapy, which can be IV, oral, syrup. The second one is surgery, and third one is radiation therapy. So these are the three important modalities which are used in different combinations depending on the disease and type and also the stage. So depending on that, these three modalities will be used in different combinations where the best benefit can be drawn. So some other treatments which are important to be noted in this childhood cancer treatment are bone marrow transplantation, which is used in conditions where we see that the disease is not coming under control with the chemotherapy, or the child has got aggressive cancer. There is a need for doing bone marrow transplantation. We do offer the treatment also. So there are some advances which have come in the treatment modalities in recent past. These are immunotherapies and also targeted therapies, which are some of the advances which are also available, and then we do provide it, and we do see that very good responses with them. But unfortunately, they are not available in all the diseases across the childhood cancers. There are some diseases which have got targets which can be targeted, so we do use targeted therapy in them. One advance which has been happening is cellular therapy, what has been coming recent past. So cellular therapy is something which is also, we can say that we take the cells from the body and engineer the cells outside in the lab, make them attack against the cancer cells. Okay, so these are called as CAR T cell therapies, or so these are some of the new therapies which are available, which has also been done in adults. Apparently, they are not approved in pediatrics for now, but that is one other modality which is rarely used and which can be used in patients who do not respond to any conventional chemotherapies which are available presently. So regarding success rate, what is the success rate that can be expected? Childhood cancers are usually regarded as treatable cancers. Almost all the cancers can be treated in children, and majority of the treatment can be successful also. So we say that around 80% of the children with cancer are treatable and curable to that extent that they live their life normally. But unfortunately, in low and middle income countries like India, we see that around 20 to 30% of the children are surviving. It's unfortunate, but this is the hard fact. Majority of the children are not diagnosed. Even after diagnosis, they are not referred properly to the referring centers. If they are referred, they have so many concerns about the treatment. Parents are not willing to get the treatment for many reasons, for their personal reasons or financial constraints. If they are taking the treatment and we initiate the treatment and then they don't continue for many reasons well known to them, and unfortunately the children are not completing the treatment what it need to be completed. So these all some of the reasons which usually combine together lead to decreased outcomes which are seen in low and middle income countries as compared to the outcomes which are seen in high income countries. In low income countries we have still long way to cover.